Welcome back. We've been talking about the state-of-the-art treatment of erectile dysfunction for a few months now, and it's really a lot more than just a physical change. Patient care advisor from Flagstone Medical, Bill Jeffries, is here to explain what that means. Nice to have you back.
Thanks, Alex. Good to be back.
So when I say it's more than physical, we're really talking about restoring hope, right? So elaborate a little bit more on what that means for men in everyday life.
Sure. Any guy that has struggled with erectile dysfunction for any length of time will probably be able to relate to this. There's a lot of things out there. There's pills and potions and injections and all types of things, and some of them are effective, some are not. Some are effective at first, then they quit working, and guys just get frustrated because they just lose hope that this is the way it's going to be. But finally, there is some new technology on the market that addresses ED at the root cause as opposed to just treating symptoms.
Right, and as opposed to, as you're saying, the onslaught of ads from all these pills and different things, you don't know where to start. So this technology really boils it down to its root cause, right? So let's talk about what that root cause is, because I don't think a lot of people realize this, and you brought a graphic to show us really what's going on.
The root cause of erectile dysfunction is just poor blood flow. It's a plumbing problem. As we age, our blood vessels develop this plaque that just restricts blood flow, and that's in fact what causes the ED. And now there's a way to fix that, to get rid of that plaque, as opposed to the standby medications just really dilate blood vessels as opposed to getting rid of the root cause, getting rid of that plaque.
Yeah, I mean, if you never get rid of that, it's just going to continue building up, right? The problem's going to become compounded, and you're not going to be able to solve it in any other way. So let's talk about the fundamental difference in this approach, which is something called acoustic wave therapy, right?
Sure. What the acoustic wave therapy does, and if we can show that graphic again, what we're doing is getting rid of the plaque build up. As we hit those blood vessels with the acoustic waves, it gets rid of the plaque, it restores the full function of the blood flow, and returns the body to a natural state of being able to have proper erectile function.
And how widespread is it? Because I mean, I'm sure a lot of guys out there think, well, there's no way that this could ever affect me, and then someday it does, and it's actually more common than we think, right?
It is. It's always been a difficult topic to talk about, so the statistics are hard to come by, but from interviews with doctors, urologists, whatnot, it seems that about half the guys, by the time they're in their 50s, are suffering with some type of erectile function issue. And that goes up with age, 60% in their 60s, 70% in their 70s, and so on. So, when you get old enough, there's a very, very strong likelihood that it's something that a guy's going to have to face.
Sure, and I mean, I know we're talking about older guys, but it can also happen to the younger ones, and it's just as good for them as a treatment too. And so we started talking about hope, and we started talking about spontaneity, and so this therapy really sort of helps with that, right? How does it help with spontaneity?
The issue with spontaneity is that with standby like medications and injections and whatnot, they take a little while to work. Yeah. So, guys have to kind of prepare and plan for when they're gonna be intimate, and that does take the spontaneity out of things. What we're doing with the acoustic wave therapy is basically just dialing the clock back a decade or two, and restoring function, the way it used to work, and guys can be spontaneous again when they're in the moment. They're ready.
Right. I mean, you don't have to wait, for something to set in or something to start working. It's your body, right? It's your body's clock. You're on your body's time.
Correct.
And so let's talk about, say a guy has a medical condition like diabetes, for example. Can those guys still get this treatment?
Absolutely. In fact, diabetes is a known restrictor of blood flow and circulation problems. And a surprisingly large percentage of our patients do suffer with diabetes, so it's kind of an indication that if the diabetes didn't cause the ED, it's certainly a contributing factor. But since this is a natural healing process. It's safe, even for guys with other medical conditions, heart conditions, diabetes, etc.
So, I mean, you can take the old approach, which is trying to deal with the situation on your own, right? And sort of not have any guidance, not really have a path. But the profound thing about Flagstone Medical is that you have this group of people that really cares about your well-being, wants to help you through this. And that's really the difference. When someone goes in there, they feel taken care of. It's just a conversation. It's like fixing a broken arm. And so that's why people really have to call in. It's partners too. If you notice that this is taking a toll on your relationship, talk about it with your guy, and that way you can get the conversation started. So Bill Jeffries, as always, thanks for being here.
But thanks for having me.
Nice to see you. And you can get a free initial exam and consultation if you mention the Morning Blend. It's a $199 value. If you want more information, visit flagstonemedical.com or call 520-600-4405.